Thank you very much. I'm here representing the Autopsy service, and many of us know that the problems with the pulmonary function are major issues in this pandemic. But we wanted to determine, if possible, what are the systemic effects and what actually happens in the lung. So Dr. Lefkowitch put together a panel. As of yesterday, we completed 44 autopsies of COVID-positive patients. So I first want to give a thanks to our resident staff who have spent inordinate hours processing tissues, doing these autopsies. And if you put yourselves back into your PGY1 mode, remember, these are people just out of medical school who are experiencing this kind of multiple deaths and the issues, which are many, attending on that. Also, I'd like to thank my colleagues in the autopsy service who've also had many cases to look at and sift through. And the biggest heroes in our department at the moment are our autopsy assistants. Lenisa Munoz, who's on the left, has been doing inordinate weekend, evening autopsies, and her assistants listed there have also come in and are a great help because they do a lot of the prosection on these cases. Also, Dr. Shabolsh, who runs our immunohistochemistry portion of anatomic pathology, has used his intellect and connections to many different organizations that provide the antibodies. So currently, just to keep you updated on what techniques we're using from the AP standpoint, we can do immunohistochemistry for the spike protein on SARS-CoV, and we also have a in situ hybridization probe for the RNA. It obviously depends on rapidity of getting the autopsy and getting the tissue fresh and fixed. And as you see in the lower right, in a robust case, you can get quite a lot of RNA. This was in a pulmonary case where the patient died with extensive diffuse alveolar damage and hyaline membranes. So what you're seeing are remnants of RNA shed into the hyaline membranes, probably from various COVID-19 viral infected cells. So we're using those techniques, and others will be developed along the way. So the assembly of speakers that Dr. Lefkowitch called on are Dr. Lefkowitch, who will be speaking next, Anjali Saki, whose office I'm using because my computer has decided to crash this morning, and she's going to tell us about the lung findings to date. And Chuck Marbo is here to talk about the heart, which is another major concern in this pandemic because many of the patients do have cardiac dysfunction. Steve Lagana is going to talk about the liver pathology angles, and we have some very interesting findings there. And finally, Hanina Hipshush is minding the fort, so to speak, because many people obviously are interested in fresh tissue and frozen tissue for different research studies, and he minds the tissue bank, the biobank, and he'll speak on how we address these research concerns.